Uh, Good evening and welcome to Showtime TV. I'm your host, Omar Rashada. May is Mental Health Awareness Month, and this evening the topic of discussion is going to be mental illness. And I have a very special guest. I've known her for quite some time. We used to work together. We went to graduate school together, so we go back a little bit. Now she's big and famous, and I'm trying to get there. And she got her own practice and everything, so she's doing her thing. Latoya, good evening and welcome to the nice program.
Well, welcome, Omar. Coming from someone who has been in this field working tirelessly and doing plays and productions and all of what you do, I'm honored to know you. So thank you for having me.
No problem, no problem. Okay, so first, let's give it, for those who may not know you, let's just give it an introduction of who you are. Let's talk about what you currently do.
Okay, well, I am Latoya Congolo, and I'm a licensed clinical social worker and licensed clinical alcohol and drug counselor. And as Omar mentioned, we've known each other quite a while. This would be my 25th year in the field of mental health and substance use disorders. And I'm also the co-owner of Work Life Behavioral Health, which is an outpatient mental health and addictions clinic in Glen Burnie. I'm also a community advocate and just working hard to reduce the stigma around mental health in the community. And also I am a former candidate for the Maryland House of Delegates.
All right, so let's talk about the field in itself. When you decided that you want to work in the social service field, social works field, human services field, I got all kind of different terms, but basically it's all the same. People say, well, this is not a high paying field. And how can you do the work that you do? I can't do what you do. I wouldn't be able to do what you do, work with a different type of population that we work with. What drew you into this field?
Well, it was my own personal experience. I grew up with a single mother and the teenage single mother, and pretty much lived in low-income housing from the time I was probably a toddler until I packed up my car and at 18 moved on to the campus of Delaware State University. So growing up in an environment where there were no fathers in the households, there was poverty, crime, just being exposed to a lot, I realized that there are a lot of people like me and a lot of kids who need, support in order to overcome those barriers growing up in an environment like that. So that's what drew me to the field. And you're right, it's not the highest paying field, but it's very rewarding in other ways. When I went into the field, I thought that I was going to help people, but then having assignments where I had to go to therapy and write a paper on it, or go to a support group and write paper on it, paper on the experience, I quickly realized that I had problems too. And the person I needed to start with and helping was myself.
Right, absolutely, absolutely. Mental health, how do we define mental health?
Well, mental health is any sort of distress that causes a person to not be able to function to their highest potential or to the best of their ability. So it can look different for different people. I would say that most people need to realize that mental health issues are like the cough and cold of medicine. To a behavioral health professional, everyone gets depressed and anxious. But some people get it to a point where it's so severe that it's crippling. But I would say, we use the term mental health, and I think the key word there is health. We need to look at this as we would any form of healthcare.
Mm. Okay, so there may be those who may have a mental health diagnosis, but not necessarily know that they have a mental health diagnosis. What are some of the symptoms that may indicate that someone is suffering from mental illness?
Well, it's going to really boil down to what we call their baseline, or what is their typical function, what's normal for them. And when a person is starting to recognize that I'm not able to function at the capacity I was able to at once upon a time, because the saying is that if anything is left untreated, then it gets worse over time. So it may be that it progresses over time. People start to kind of realize, I'm just not feeling the way I used to feel or I usually feel. It can be triggered by an event or some change in their life. It could be a loss. It could be, just anything can really trigger mental distress. But it really is about the person and maybe the people around them realizing or recognizing that this person has changed.
Mhm.
And that change would sometimes indicate that there is some sort of mental health issues going on.
Right, and there are also cases where you may see that a mother is diagnosed with a mental illness, and she may have a son and daughter who also diagnosed with mental illness, and then their son and daughter may be diagnosed with mental illness. Is it safe to say that it possibly could be genetics?
It's more than safe to say that. In fact, that is the number one risk factor or contributing factor, I would say, to someone developing a mental disorder or substance use disorder. If there's a family history, the brain is wired differently. It's wired to be sensitive to those disorders. If there's a history of depression and anxiety, what that means is that in that family, that their brains may not be able to naturally create the chemical balance that a brain needs in order for a person to be able to meet life on life's terms. Even with substance use disorders, if a person's brain is wired to be more sensitive to substance use, then that could create that dependency, because the brain is just a little extra sensitive to those substances.
Yeah, you just mentioned substance abuse disorder. There are cases where individuals, if you will, have both diagnosis of a mental health disorder and a substance abuse disorder. In fact, they call it as a co-occurring disorder. Do you find that quite often in your practice, your line of practice?
Absolutely, it's more common than not. Statistically, about 80% of people who use a substance have an underlying mental disorder that may not be treated. So as a clinician, I don't focus so much on what a person uses. I focus on why a person uses. There's always a why to the drug use. And the purpose of treatment or therapy is to really get to the root cause of the drug use or the alcoholism. And a lot of people may not be aware of it. They might not make the connection, but our job as clinicians is to make the connection between why they use and why they look at drugs as the solution and not the problem.
Right. We had a discussion on my former place of employment. I don't know, this is the very first time that I heard this discussion. It was about maybe a year ago, a year and a half ago. And the question arose, what if a person has co-occurring disorder, do you treat the mental health first or do you treat the substance abuse first? What is your take?
That's a good question. I mean, the truth is that you have to treat both concurrently, because they both come with symptoms, and a lot of times those symptoms they look very similar. So think about, and I'll give you an example. A co-occurring disorder would be alcohol use disorder and depression. We know that alcohol is a depressant. So the symptoms related to alcoholism, the low energy, the lack of motivation, sometimes people feel hopeless or worthless. That very much can look like depression, clinical depression. So let's say you have someone who went into drug and alcohol treatment. They haven't had a drink in 60 days. They have a sponsor. They're going to AA. They're doing all the work to remain abstinent from using alcohol. But they're not seeing a therapist. They're not taking an antidepressant. They're not learning coping skills to manage the depression. So, Omar, I'm just asking you, what do you think the chances are that that person is still going to be motivated to go to meetings, pick up the phone to call the sponsor, reach out to someone when they're having cravings, get up, get in the car, drive to a meeting, if they still have the clinical depression there that's not being treated?
Oh,
What is their level of motivation on a scale of 0 to 10? 0 being no motivation, 10 being highly motivated. What would you say?
Well, I'm gonna say between 0 and the highest 3, because they're gonna be dealing with some psychosocial stressors. They're not gonna have developed the coping skills necessary to deal with those stressors. So what he or she may do? Go back to the bottle,
Absolutely. But you just nailed it. That's exactly what it does. So we have to treat both disorders at the same time, because if you leave one hanging and you don't pay attention to one, it's going to cause you to fail in the other area. It's the
Okay,
same
yeah,
thing with if you were to reverse it. This person sees a therapist, they're taking an antidepressant, learning all these coping skills, but in the back of their mind, they're like, oh, alcohol is not the problem. It was just a depression. But what happens when those cravings kick in? What happens when they have that stressful day?
right,
All of the things that could now trigger them to use when they drive past that liquor store, because they're not worried about the alcohol. They put that on the back burner. It's all about the depression.
right,
It's only a matter of time before they walk into that bar, walk into that liquor store, and pick up a bottle, because they left that alone, put it in the background, and focused more on the depression. But the point that I'm making here is that both need to be treated concurrently, and that will put a person at higher risk for success for recovery.
right. Well, you mentioned the groups that you have AA groups, you have NA groups. What is the difference between AA groups and NA groups for those, just for educational purpose, for those who?
Yeah, so Alcoholics Anonymous is a 12-step program that focuses on a person who is struggling with alcoholism. Narcotics Anonymous is also a 12-step program, and that program focuses on addictions to illicit substances. But they both follow the same 12 steps, the same 12 traditions. They both offer sponsorship, a network. They pretty much are very similar. It's just the substances that they focus on are different.
Right, and then also we have DNA groups.
What's that? The NA groups
No, no,
or?
no, the DNA groups, the drug and alcohol groups.
Okay, you have DNA, you also have smart recovery, you also have
Okay,
celebrate recovery. Smart recovery is more cognitively based, where it really just helps a person recognize their thought patterns that lead to increased mental health symptoms or increased drug and alcohol symptoms. So
right,
that is more science-based. It's not spiritually based so much as NA or AA. And then you have Celebrate Recovery, which is more
okay,
spiritually based or religious. It's usually, those meetings are usually held in churches,
right.
and, focus on God, and not specific to anything. It's just anybody who has a hurt, habit, or hang up can attend Celebrate Recovery meetings.
When I first became into the field, um, I seen where there were some, I guess we refer to them as clients. They will be in an inpatient substance abuse program where they received, group therapy, individual therapy, medications, and so on. And they've been clean for 6, 8, 9, 10 months, the whole time they were there. However, the minute they were discharged, they came back to uh, their place of residence, or wherever he or she may reside. Not too long afterwards, they relapse. Um, Talk about the significance. You often hear people say, stay away from different places, people, and things. I guess that statement can be very much true.
Mhm. It's very true. I mean, the environment plays a big part in a person failing, or not saying failing, but having setbacks, and or a person succeeding. Um, the environment plays a big part. What support do you have there? What are the triggers that are around you? There are some environments that make it more difficult for people to do well in recovery. Especially if they're going back to their old stomping grounds and their old friends are there. And, personally, I've never had an issue with drugs and alcohol, but I can honestly say that just leaving Delaware for some reason, I came to Maryland, and I just felt like I had a fresh start, just to, be a person that for some reason in Delaware, I just had too many ties, too many, old memories that kind of stay stuck there. And I was kind of always reminded of it when I drive through Delaware, even to this day, those memories are there, and driving through my old neighborhood or seeing if somebody I went to school with. So the environment really does shape your mindset, and it can shape the mind for reverting back to old behaviors or moving forward and creating new behaviors, new healthier behaviors.
Right. So, one of the things about seeking mental health treatment, one of the first steps, I think probably if the first step, is admitting that he or she has a issue, has a problem. If you look at the history, and particularly the African-American history, I was told that if you didn't see a psychiatrist, you just dealt with your problems. I don't want to see a shrink. I'm not quote unquote crazy. Do you think that 2023, we're in May of 2023, do you think that the people are more accepting to recognizing that he or she does have a mental illness, and we're not looking at it as quote unquote a stigma?
I think we're moving in the right direction. I think that I'm seeing more people of color seeking therapy, and not just African Americans. I mean, you got to think about people of different cultures. I'm seeing people who are Middle Eastern or Chinese or Caribbean or Nigerian. I mean, I'm seeing it all, and it really is kind of the faces are looking different. But what it has shown me as a clinician is that just because I grew up poor and in a single parent household and had all of these adversities in life, my problems are no worse than the middle class person who grew up in a 2-parent household with a single family home and a white picket fence. It just really proved to me that we all have issues, and it just boils down to how we deal with our issues.
So, when someone agrees to seek help, counseling, psychotherapy, whatever you want to name it, and when you walk into a particular office, right? Because I want to ask you how is your office set up, and the reason why I'm asking, because they could play a big role in terms of whether or not someone wants to seek treatment or not at that particular office. For example, let's say if you have someone of color walks into the office, looks at the magazine, he or she don't see no one. The magazines, the people on the cover or the magazines that they cover the topics on doesn't relate to the individual, doesn't look like the individual. Someone may look at pictures on the wall. They may see the opposite culture, but no pictures of themselves, and they may look and say, you know what, man, this office may not be for me. I don't see nobody here that look like me. I'm African American. I don't see no black psychiatrists here. I don't see no black magazines. I don't see no black pictures. Do you think that the setting of an office can play an important role in terms of someone whether or not he or she want to seek treatment at that particular location?
I think that it does matter to some clients. I'll say that I've had people mention that they had a preference for a clinician who, looks like them. But I'll say that the environment, the setup of the office, like my office in particular doesn't look particularly black. I mean, I don't have a fist on a wall. I don't have red, green, and black anywhere, but it's a calming, warm environment. We have staff that are of different backgrounds, diversity. I think that if people come into my office, they'll see someone for the most part who will look like them. But I think overall, people look at quality of care. They want to be treated with respect. They want someone who's going to be compassionate and really meet their needs. But you know what? The truth is that I'll give you an example.
Mhm.
We struggle with finding Hispanic therapists, therapists who speak Spanish. So there are less representation in some cultures, some ethnic groups than in the African American community.
Right.
And I see that disparity. But is it a barrier to people getting treatment? Perhaps. But overall, people just want quality care, and they don't matter who the person looks like for the most part.
Right. Definitely. We focus thus far on adults. But children, well, they also have places for children. Here in Wilmington, I think Rockford and Meadowood may have treatment facilities for young people, and I really never really thought about that. Because the focus is so much. When I first started the field, the focus so much was on the adults. But how often did you see children who are suffering from mental illness?
I see kids all the time as young as 4 years old. Yeah, I mean, it's getting worse. It's gotten worse since the pandemic.
Right. Okay.
I'm seeing more kids today than ever before.
Hmm.
And it's really scary to me. It's scary in the fact that kids have issues at home, and spending almost 2 years in the home environment that may have been dysfunctional or chaotic. It's showing in their behaviors. I don't think that it's healthy. This is my professional opinion. I don't think it's healthy for children to seek therapy and parents not be included in the therapy. Here in Maryland, there was a law passed that allows children as young as 12 years old seek therapy and not disclose it to their parents. We know as clinicians that children do better in therapy when their parents are included, when their parents are learning the skills, because a lot of the issues that are going on with children are in one of two environments where they spend most of their time, and that's either at home or at school. So if we don't have the parents involved, if the schools are shutting out the parents and mental health professionals are shutting out the parents, how do we expect things to change at home for the child?
Right. You may mention that things got worse since the pandemic. What was it? What is it about the pandemic that you think made it worse?
Isolation, kids losing social skills, kids spending more time on laptops and on social media and technology, not being as focused, that the concentration is gone, the lack of motivation to get up and go to school. They lost that structure. And these are the things that kids need in order to develop and thrive. They need structure. They need to, their minds need to be stimulated. And now they're being stimulated by video games and social media.
Mhm.
And
And
we already know what that does to a child's mind.
yeah, I've seen way too many cases. One case is too many cases where a child face is what's called cyberbullying, online
Mhm.
bullying, and as a result, he or she has taken their life. I mean, wow. I mean, imagine a kid thinking of taking his or her life. I mean, wow. I mean, growing up, I'm quite sure we never even thought about that. That was never even an afterthought. But in today's society, how often uh,
Mhm.
do we see suicide?
Yeah, and it's on a rise, and it's on a rise, especially with African American children. That's the
Mm.
fastest growing rate for suicide. And it's so sad, because this culture, this generation, they'll just tell each other, even if they think they're joking, they'll just tell a kid, "Oh, just go kill yourself."
Mm.
They just throw that around like it's just, something that is normal, not realizing that if you say that to the wrong child who's thinking about it, that if they're bullied enough and people are just telling them to go kill themselves, then, that just reinforces those suicidal thoughts. And, even here, I've had kids that they'll jokingly say to their peers, "Oh, let's do a wrist check." Because
Mhm.
maybe this person has cut their wrist. Now they say they're going to do a wrist check. So it's the cyberbullying is real, and it is adding to children now being more likely to think about suicide, or even act upon those thoughts.
Right. And of course, there's not only children, but adults as well. But let's focus a little bit on, the warning signs that may indicate he or she may be even contemplating suicide or have thoughts of suicide. Are there warning signs that we can see?
Hmm. Yeah, and usually, like with the younger people, it's usually those social media posts. They may maybe put out subtle messages as a silent cry for help, and something that's really down and expressing their feelings through social media. It can be their peers, they're texting their peers or disclosing to their peers that they feel like they just want to end it all and they can't take life anymore and nobody likes them. You just got to listen to those words and their actions. If they're just not having a desire to go to school, they're severely depressed, they're disconnected from their family or friends, just seeing those behavioral changes, because it's usually the behaviors that you see, not necessarily the words that you hear.
Right. In regards to adults, what are some of the warning signs you may see from the adults?
Well, for the adults, it can be giving up prized possessions. Now all of a sudden you see all of a sudden a burst of energy or excitement in them, because a lot of times they'll have that sense of happiness towards the end. And the thing is that no one dies by suicide because they just want to end it all. What they want to end is the pain, the suffering. And that's what they're wanting to escape. So with an adult, you may see that level of excitement in them because they see it as an ends to a means. Like this is I'm finally going to be free of this depression, this heavy burden that's on me. And then sometimes they will make statements about life and what they're not happy with. But those are some of the warning signs. Increased drug and alcohol use, that's another warning sign.
Okay, got you. So I don't know if you're familiar with the case that happened, I think maybe a week or 2 weeks ago in the New York subway, where it was a homeless gentleman that got choked to death, and that caused an outroar in the community. And there's been local protests. And this gentleman was screaming because he was hungry. He was homeless. He doesn't have a place to live. He doesn't have anything to eat, and he was just expressing his thoughts. And unfortunately, he scared, I guess, some of the other passengers on the subway. And as a result, guy came from behind him, put him in a chokehold, and we all know what happened after that, unfortunately. Well, society and their knowledge of mental health, would you say needs to be increased? Or do we need to be more supportive of those with mental health conditions as well as substance abuse issues, and not be judgmental? And we had to look at it from the outside that, hey man, this person is really struggling.
One of the reasons why I ran for office is because most politicians have very little knowledge of mental health and substance use disorders. And they're creating laws that are, in many cases, doing more harm than good because they lack the awareness. I would encourage any mental health professional to consider running for office, because we need to be at the table. We recognize that when people are sick in their mind, they're not going to be functioning citizens in society. So we need to take this seriously, because we're losing a generation of workers. We're losing a generation of healthy, strong parents that are going to rear healthy, strong children. We lose so much as taxpayers in every sense that you can imagine. We lose so much as a society when we don't take care of the sick. And the strongest organ in our body is our mind. When that mind breaks down, we break down as an individual, and then our society breaks down.
Right. So what type of services do you think we need? I guess, speaking here in the United States of America, how can we improve the services that are offered for mental health and substance abuse? What do you think needs to happen?
Well, I have several ideas, but I don't know if you're familiar with adverse childhood experiences or the ACEs questionnaire.
I think I saw it before.
Okay,
I'm not quite
so
sure.
yep, so the ACE questionnaire, and I would encourage the audience to look it up. Just Google adverse childhood experiences. So ACEs are 10 questions. So those 10 questions are kind of looked at as markers for what will increase the likelihood that a person will have a PTSD or trauma. And it also looks at if a person has more than 4 adverse childhood experiences, they're more likely to have they're more likely to have a mental illness, to have a substance use disorder or alcohol problem. It points to hypersexuality, an increase in diabetes, obesity. I mean, it really does break down a lot of, unfortunately, what I see going on in our society. And these 10 questions are geared towards what happened to you before the age of 18. What happened to you in your childhood? Because our childhood really shapes our adulthood. And those questions, I feel like, should be in every OBGYN's office. When a woman is considering getting pregnant or she is pregnant, they need to put those questions in front of every patient to say, this is what you want to protect your child from for the next 18 years. Those questions need to be in every school. Every parent should be educated on it, because if we can protect children from those adversities, then we're more likely to produce a healthier generation. So that's one thing I would say is people being aware of adverse childhood experiences. The other thing we need to is to increase 2-parent households. Rarely do I see a child who came from a healthy, intact household with 2 supportive biological mom, biological dad who raised them. Rarely do I see those kids with severe mental illness or trauma. That is the biggest protective factor against every societal ill. And, us in the Black community, I'll put it out there, we can't afford another generation of single parenthood. We need to now teach and train our children to prepare them for being good husbands, good wives, and what skills it takes to develop a healthy family unit, because that's what's going to save us. And we need to promote that, encourage that, incentivize it, whatever we need to do. We need to now get that message out to our community that this is no longer working for us. Kids need a mom and a dad. It'll make my job, any clinician's job, so much easier if people just had 2 healthy parents raising them.
Exactly. So are you, do you ever think about mental health in regards to the prison system? Because there may be those who maybe have that. Well, I'm quite sure there are those inmates who are in prison who has a mental health diagnosis. Unfortunately, may not be receiving medications, may not be receiving therapy. Do you have any concerns in that area?
There are huge concerns, because if you think about it, I'll tell you, I worked in the criminal justice system, when I was towards the end of my college undergrad years. I've worked in child welfare. I've worked in outpatient mental health clinics. I've worked in addictions clinics. And what I'll say is that I see the same profile of the same person in all of those systems. And usually what it is someone who grew up in poverty. They may have experienced trauma. They had a single parent household, an absentee father. You hear the same story. And that doesn't mean that everyone who grew up under those circumstances are going to end up in the prison system. I mean, I grew up under those circumstances. Plenty of people I know have, and who are successful. But the risk is higher when someone has that background. They're more likely to end up in the criminal justice system. So absolutely, yes, there is a huge rate of mental illness in our criminal justice system, and it needs to be addressed, because once a person is released, they're more like, recidivism is high. They're more likely to commit another crime and end up back in the prison system.
Right. Let's talk about your practice for a moment. What population do you serve? Do you offer individual therapy, group therapy? What age population do you deal with?
Yep. So we see kids as young as 4, up to geriatric age, 104. I don't know, but people of all ages, all backgrounds. We do individual therapy, couples, family therapy. We have a total of 4 therapists who have different specialties. And anyone who calls our office, they're able to get matched with an appropriate therapist based on their needs. We also do training for social workers, counselors, drug and alcohol counselors, peer recovery specialists. We're a nationally approved, accredited training institute. So we do continuing education credits for professionals. We do a lot of community advocacy. So we do a lot here, inside our office and outside in the community.
CEUs, are they in person or online, or specifically in person?
No, we do both. So we offer teletherapy services and in-person sessions.
Oh, wow, that is so awesome. Faye, I'm so proud of you because, you pretty much built your own empire. You got your own business. We work together in two different particular outpatient mental health programs, and then you got your own. You ever sit back and think how far you have came in regards to building your own business? I say empire, but I like the word empire because it represents strength and dignity and compassion. You ever just sit back and think, wow, look what I've done, look what I got.
I sit back and I say, wow, look what God has done. Look what God has blessed me with. I never say I because it is not about me. This is all God, Omar. And I know for a fact that this wouldn't be possible without him. He guided my steps. He blessed me with a husband who had the vision. I can't take the credit for this business. My husband had the vision and the dream, and I was just a doer who executed it. But it took a lot of prayers, a lot of sacrifices. I'll say to anyone who's thinking about starting their own business, be prepared to cry some nights, to scratch your head and wonder if you're going to be able to pay your rent, your overhead, your staff. All of that is part of it. It hasn't been an easy journey, but where we are today, going into our 7th year, is not where we were year one. It's amazing what God has allowed us to endure to get to this place.
And that is awesome. Now, are you looking to hire more staff? And if so, what credentials are you looking for?
So we're looking for someone who is at least a master's level licensed professional. We also take interns. So if someone is in a graduate level program, they can come here and complete hours, get supervision, see clients under the supervision of myself. So yeah, we're always looking for staff and looking to grow. So if anyone is interested, I can certainly provide my contact information.
Okay, we would like to do that as we close the show out. But when you say license, are you looking at licensed professional counselors in mental health? Like looking for licensed clinical social workers, licensed master social workers?
Yeah. So I'm approved by both boards to supervise professional counselors as well as drug and alcohol counselors and social workers. So I'm able to provide supervision for full licensure to those professionals, graduate level professionals.
So are we going to see Dr. Latoya? Or are we going for doctorates?
No, I'm done with school. The thing is that I actually had some students at a high school ask me, they said, well, why did you go the social work route and not become a doctor of psychology? I said, well, because a master's level social worker can practice independently and bill for the same services. We just spend $100,000 less in tuition because we don't have the doctorate. So for me, it just made more sense financially. I didn't come from a family of means, and I didn't want to take on any more student loan debt. And it just allowed me to be able to get licensed faster and cheaper. So it was a better route for me. So no, you will not see doctor unless someone is going to give me 100% tuition-free education.
Right. And you mentioned peer recovery specialist. For those in the audience who do not know, what is a peer specialist?
So a peer is someone who has the lived experience of recovering from a substance use disorder or a mental disorder. And what they do is they offer mentorship, resources, support to people who are new to the recovery process. They're also the face of recovery to say, I was once where you were, now here I am today. And I can't speak more highly of peer specialists. I think that their experience allows them to connect with people in a way that a therapist like myself or a doctor or a psychiatrist ever will. So peers are crucial to the recovery process.
And one of the things that we see over the last several years is people are doing remote therapy. What is your opinion on remote therapy?
It works for some. I would say that since we implemented telehealth, we have a lot less client cancellations. People are more likely to keep their appointments because they can, close their office door during their lunch break, or they don't have to worry about finding a babysitter, or, rushing to the therapy appointment after a long day's work. So it really has made it more convenient for people to stay engaged in therapy. So I love it for those people. But then you have some who prefer face-to-face. And if a therapist is flexible, we offer both. We see client retention is even better since we've started the teletherapy.
Awesome. All right, so I want you to say any closing words for those who have mental illness and diagnosis and contemplate whether or not to get help or not, or those who suffer from substance abuse disorder, whether or not they should get help or not. If you could say some encouraging words for he or she, and then also let us know your business hours, your contact information for those who want to seek therapy or treatment at your facility.
Yeah, so what I'll say to everyone is that, you really have to look at mental health care as you would any other health care. If you have a doctor, a primary care doctor that you see annually, or if you have, a dentist that you see every 6 months for teeth cleaning, just really consider that mental health is the same thing. It's just a checkup from the neck up, and there's nothing wrong with it. It doesn't mean that you're sick because you see a therapist. Some people just see a therapist just for added wellness, just to vent if they're having a stressful day and they don't want to burden their spouse or their family or friends with their problems. And it's just a great resource, a great tool, just to keep us functioning. I can tell you, I'm a therapist, but I saw my own therapist yesterday. I'll see her again next week. And that's important to me. You want to make sure that your therapist is seeing a therapist, because we all need it. It doesn't make us sick. If anything, it makes us well. It makes us better functioning members of society.
All right. Okay. What's your contact information?
All right, so contact information. We are Work-Life Behavioral Health and Professional Training. So you can reach us at worklifebhllc.com. You can also like our Facebook page, Work-Life Behavioral Health, and our contact phone number is 410-487-6052. So if there's anything that we can do to service your needs, if you're in the state of Maryland, please feel free to reach out.
All right, please like, subscribe, and share. And thank those for watching this evening. Latoya was a great guest as always. I'm quite sure seeing another invitation in the future.
I'm looking forward to it, Omar. I'll be
All right,
here.
thanks a lot. All right, have a
All
great
right, thank
week.
you.
Oh,
All
happy
right, have a
Mother's
good
Day.
night. Thank you
Yeah, happy
so much.
Mother's Day.
Thank
Okay.
you so much. All right, take care.
Bye-bye.